emerged on our continent a few years ago. And Maria, I don't know if you want to add to that in terms of what we're doing moving forward.
Thanks very much, Chikwe, and thanks very much for the question. No, to really re-emphasize what's been stated by the chair and by Chikwe here. This isn't about saying that Mpox isn't a problem. It isn't saying that Mpox has gone away. We expect continued circulation. We expect there to be flare-ups in other countries, but as the chair has pointed out, as DG has pointed out, as Chikwe has pointed out, capacities continue to increase, and the ability of our national counterparts, our local partners, across diagnostics, across community engagement, clinical care, safe and scalable clinical care around infection prevention and control has increased. Of course, there's a lot more work that needs to be done. There's more work that needs to be done for early diagnosis, early clinical care, ensuring that vaccines are used appropriately to protect populations who are most vulnerable, those who have immunocompromised HIV populations, the youngest of children. So for us, this is a really important message that lifting of the public health emergency of international concern doesn't mean that the problem has gone away. There isn't a lot of investment that is necessary, including not only the technical capacities, but financial investment as well. We haven't raised funding for Mpox with the last SPRP, and of course, this message might sound like, the problem has gone away, but as DG has pointed out, it has not. And countries are working very hard, and you've heard about concurrent outbreaks, now Ebola. So there's a lot of challenges that these countries are facing. So we need our partners, we need funders, we need governments to continue the solid investments in Mpox and in fact to increase those, because what we do for one infectious disease is also helpful for others. So it's adding on those and continuing to build those capacities.
Thank you all very much for this. And we have one more from Amy Maxman from Nature. Amy, please go ahead and unmute.
Hi, thank you so much for this conference. I was just wondering, the response to outbreaks, specifically Ebola outbreaks, is super expensive. And I'm just wondering, what is the impact of the withdrawal of the US from the WHO? Have the membership fees already, I assume the US isn't contributing anymore. How are you financially?
Thank you very much, Amy. We'll go to Dr. Chikwe Ikwazu, the head of the emergency program.
Hi, Amy. Thanks for that, and great to hear your voice again. I think if we reflect on the Ebola outbreak going on at the moment, I think the most important thing, I think that we can all be a little bit happy with globally is really the response of the colleagues locally, the speed of their action, the ability to connect the dots. Once they had a fairly small cluster of cases and a number of deaths, how quickly they alerted their own national public health agency, how quickly that agency put the resources together, alerted WHO, the time it took us to get to the field, get the samples to the lab, get it tested, have a sequence out and published today. I mean, yes, a lot of resources are required, but the experience in DRC really shows that investment in local capacity, investment in building institutions and country capacity around the world will ultimately actually reduce the need for resources globally from one single donor for a couple of big sources to continue to support the work that we do. Having said all of that, there's no doubt that we will continue to need the resources to respond. And, the only way we can do this sustainably into the future is through sustainable financing of WHO. So, yes, the financial situation we are in challenges all of us, but our work goes on. Our primary response has been as good as it can be. And the challenge on all of us now is to sustain the response over the next few weeks. Make sure that we are as quick as possible to define the extent of the outbreak, which is really the primary objectives over the next few days, and then sustain the outbreak to make sure that we don't end up in an unfortunate situation. But I'm fairly confident that with all the efforts happening already, that we'll get ahead of this. Abdi, maybe you can say a few words on just the intensity of the response over the last few days and the work we've been doing with the colleagues locally.
Thanks, Chikwe. I think you have covered most of it. In terms of our work in WHO and the leadership of the government, we have been supporting them in deploying a multi-response team to all of team. But the logistic challenge, the team left on Wednesday and they just reached today morning. It's just how difficult it is. But despite that challenge in having the result there within and then publishing is incredible and remarkable. And as you rightly said, the investment that have gone to the country, that's the only way sustainable. But we really require the health system, as Dr. Tedros talked about, MPOX and all this, the vulnerable, that investment going to Gavi, to PEPFAR is the health system required. While DRC has a lot of experience, be it in Tanzania, in Rwanda, the withdrawal of that has affected the whole health system. Sampling transport was a major challenge. So the investment done by the countries, I think they will, but the sudden withdrawal has created a shock. Not the country will not be able to allocate resources. We have seen every other country coming in, but the sudden withdrawal without notice has impacted. And by the end of the day, it's the global community that's going to lose. So from WHO side, we are very confident that under the leadership of the government, that this outbreak will be able to control. We request more. We have the contingency fund, as DG said, $500 million. And Amy, you are right. Ebola response in a very difficult logistic can expand millions of dollars from 300 million to 800 million. We don't believe we may need that because of the rapid response from the government and the leadership, but the location it is in the southwest and neighboring province and neighboring country, this can also turn up to a large outbreak. We don't anticipate that because of the timely interventions, but I want to agree with you, this is an investment. It may look more, but it's an investment in the global security that requires every country, where the US, UK, neighboring country in Africa, to come together in solidarity to support DRC, because what they have done is incredible. That transparency, I don't think we have ever seen, and I want to give credit again to that team. Collect that sample and publish it immediately and declare the outbreak without fear, because they are confident what they were able to achieve.
Thanks so much, Paul, for these clarifications. We came to the end of the questions, but we have Dr. Rick Peppercorn from the, oh, pardon, did I lose somebody? Oh, sorry, Dr. Janet Diaz, of course, on the Ebola question.
I also just want to, I'm not going to repeat what my colleagues have said, but also give a big congratulations to the INRB and the Ministry of Health for their rapid action. And of course, the interventions that are ongoing now at the field level, the importance of the local teams in establishing their treatment center, making isolation centers, taking care of those patients, setting up a referral systems, all of these things, doing the basics well, which had to start. And now with the surge teams that are going in, and it's not just dependency on one group, it's a collective action with partners. And I also wanted to acknowledge all the partners that are contributing to this, and everyone together with their resources, with their assets coming together to deliver on what the Ministry of Health is trying to accomplish. So I think this is where we are in the phase right now, is really getting the partners together, working under the leadership of the ministry to establish safe care, to establish ensure that the vaccine delivery gets done in a timely way, and to advance and hopefully stop this outbreak as soon as we can.
Thank you so much, Janet, for that important addition. Now we come to Dr. Rick Peppercorn, our representative in the occupied Palestinian territory, to add on the respiratory disease which we are targeting before.
Yes, thank you, Christian. Just 3 points. One, it is specific to reported acute respiratory infections cases. They increased, with morbidity rising from 58 to 62% among reportable diseases. So it's increased with this, not as much as people say. No COVID cases were confirmed. And meanwhile, I think the acute watery diarrhea declined from 42 to 35%. We also, of course, check on other things. One new AFP case was reported, and in total in 25, it was already 49 cases. A total of 1,075 suspect meningitis cases were reported between May and August. 73% were classified as viral meningitis, and 27% as bacterial meningitis. And Since June 2025, a total of 103 suspected Guillain-Barré syndrome cases were reported, with 11 associated deaths. Serum samples, 20 of that has been dispatched. There's an absolute lack that I already raised on lab supplies related to that. I want to get back to one other point, which I think the DG pointed out about this plans for an ongoing military incursion in Gaza City. And of course, rightly was said it would be another humanitarian disaster on the existing disaster. But just to point out what it would mean for health system, for the struggling health system. Currently, 11 out of the 18, what we call partially to minimum functional hospitals, are located within Gaza City. They account for 35% of total inpatient bed capacity in the Gaza Strip and 48% of all intensive care beds in the Gaza Strip. So if that goes away, I mean, if that falls away with it, can you imagine even the impact on the health system and the health sector? Last point on Medevac, because DG stressed this so much and rightly so. Just to look at the figures that close to 7,700 patients have been medevaced. Massive achievement, but more than 15,000 patients are in need. People ask me often, yeah, is the system working? Currently, there's a priority list of over 8,000 patients ready. So more than 8,000 patients are waiting to be medevaced. And the key asks are, again and again, we need many more countries to receive Gaza priority patients. We need to have the traditional referral pathway to the East Jerusalem Hospital in West Bank restored, and those hospitals also supported. And we need to support also the WHO team here. We are ready to expand the medevac and also our OSL operations, but of course, we need flexible support for that. Over to you. Thank you very much.
Thank you very much, Rick. And let me ask Dr. van Kerkhoff to add on the situation of the respiratory diseases in the region, maybe.
Yeah, thanks, Christian. So zooming out a little bit, just to add a little bit more context, and to say, you know, we're supporting to get more laboratory diagnostics in to support the country as well. But of course, these viruses are circulating. Respiratory viruses are circulating. COVID is not gone. It's not in the news anymore, but it is circulating. We are seeing increasing trends around the world for COVID circulation, but very few countries are actually reporting now. Flu is circulating as well. And if you have conditions where people are living in these horrible conditions, you have underlying conditions, you have malnutrition, you have starvation, outcomes are going to be worse. Rick outlined all of the diseases that are circulating there that are killing people, that are harming people. And of course, respiratory pathogens are there as well. So we will work and continue to support, and Nabil is sitting over here as well, to make sure that we provide additional diagnostic resources there. But of course, there are many, many immediate needs of the people of Gaza. But just wanted to contextualize this to state that these viruses are circulating around. And it's likely to be something that is common. But of course, we will continue to work with the country to make sure that we identify. Thank you.
Thank you very much, Wolf, and thank you very much all. We've come to the end of our press briefing, and I thank you for your participation, especially also Professor Goyna, the chair of the MPOX Emergency Committee. We'll be sending the audio files and Dr. Tedros' remarks soon after this briefing. And then for any follow-up questions, please come to us at mediainquiries@who.int. Now, let me see. Let me give to Dr. or Professor Goyna if he wants to add a few closing remarks from his side.
Yeah, thank you very much. I think just to say, I appreciate once again the WHO DG and his team for the work that's been done. As everybody has emphasized, we have competing health challenges across the globe, MPOX being one of them. And it's very important that we work collaboratively and collectively to ensure we address our public health challenges, including the challenge of MPOX. Thank you very much for the opportunity.
Thank you very much, Professor. And before we give now to Dr. Tedros for the closing remarks, let me ask our Director of Communications, Gabi Stern, to share a summary of her last years with us here. Thank you very much.
Thank you, Christian. Thank you, Dr. Tedros. Thanks to everyone for what you said about me today. And it really should be said about the communications staff at WHO in countries, regions, here at headquarters, but also our brilliant technical colleagues who have done massive communications over the years, including during the COVID pandemic, which obviously was a historic and also terribly difficult period for the world. I just wanted to say thanks to reporters online. I was one of you for many decades. In many ways, I'm still one of you. I think once you're a journalist, you're always a journalist. And I thank you for your coverage of all the health issues of WHO. And I encourage you to continue being fierce and telling the truth. We need you more than ever. So thank you, and back to you, Christian.
Thank you very much, Gabi. Now, over to Dr. Tedros.
Thank you, Gabi. Again, all the very best. You're an amazing human being, and we will miss you. But once WHO, always WHO. That you should know. Then to the members of press, thank you for joining us today, and see you next time.
Recording stopped.